on what you look like.
But it's such a nice picture.
No. Oh, there we go.
Hi, everyone.
He's at the Northern Lights.
There.
Exactly.
I think we could all do with a bit of a trip away to anywhere other than our local residency. The Northern Lights would be a good one. It's definitely on my bucket list.
I went to the ice hotel in Sweden.
Oh no.
Circle, and we didn't see the Northern Lights, so I'm going to have to go back.
Oh no. Seriously, the ice hotel.
Yeah.
It's just so wrong in so many ways. Okay, so I think that we are going to kick off and we'll let the latecomers join as they arrive. Oh, there we go. Is Mr. Vosloo? Hello.
Good afternoon, everyone.
Good to have you with us.
Same, thanks. Good to be here.
Okay, so we'll kick off and we'll let the late ones join as they come on. Believe it or not, this is week 22. It doesn't sound like a lot, but I think that having been in lockdown for this long, it's a big number. So all very exciting going into level 1. Lots to look forward to. Hopefully some international travelers. Hopefully some of you will be able to get out and get some vacation time. And life will, I'm not going to say anything about normal, but we are now going to move forward and hopefully rebuild our economy if it's possible, but start making changes and hopefully positive ones. So today we are privileged to have Gary Benatar with us from Relog. He is going to share the topic of will supply chains assist in ending the pandemic with us. And I know that he's going to share lots of good stuff with us and keep us well entertained. So we're looking forward to the session. Gary, thank you for giving of your time. I know that it's scarce at the moment, so we really do appreciate you taking the time out to do this for SAPEX. I will let you do your own personal introduction for those that don't already know you.
Okay. Good afternoon, everyone. Welcome to this session. Thanks for giving me the opportunity, Tonya and SAPEX. So the COVID-19 pandemic has been with all of us and has touched all of us in different ways. And I think we tend to, as supply chain professionals, think, well, it's a medical issue and they're going to solve it with a vaccine, and there's going to be a vaccine, hopefully. And if you listen to Trump, it's coming out next week, and all Americans will get it the week after, and it will be gone. It will just disappear, as Trump says, and he uses his hands, and he says it will just disappear. Okay, well, we've heard of bullshit, and sorry about the language, but that's where it is, and it isn't that. And if you think about it practically, we as supply chain professionals actually hold the key. Because you can develop a vaccine, you can develop medical cures, you can develop all of that. If you cannot get it to the people, which is going to take supply chain to do that, you're going to be up the pole, to put it bluntly. Okay, let me hope that my slides move. Come on, there we go. So that's supposed to be a lovely picture of the virus and the pandemic. I don't know if that's some sort of plasticine model, or is that actually what a electron microscope sees, but it's something that we've seen on the TV and the news, and we've been living with this for the last, what can I say, 6 months. So let's talk about the timeline of COVID-19. In December, the World Health Organization notified us of an unknown pneumonia-caused patient in China. Okay, there was a public emergency and an international concern declared by the World Health of what's happening in terms of the supply chain, and in terms of what are we going to do with this thing? And no one knew anything. Is it going to be similar to SARS, MERS, or bird flu? And with respect to us in South Africa, we tended to skip those ones. So it didn't really affect us. And questions were asked, will the entire world be affected? So in January, started to hear about isolated infections around outside China begin occurring. Some countries started implementing travel restrictions to China or from China. But the world as a whole continued to function. We were traveling to Kenya for work and planning our Logimat conference in Germany in March, with a departure planned for the 7th of March. So, I mean, who knew, maybe it will happen, but somewhere down the line. So it was actually an interesting challenge of where we are. Okay. So infections ramped up in Europe, and suddenly they named it COVID-19, and Italy suddenly became the epicenter. In February, flights started being cancelled. Milan airport and others started to close. They cancelled the Geneva Motor Show at the end of February, which was due to open on the 4th of March, about a week before it was due to open. I had tickets to go to the motor show, so I was quite upset about that. And suddenly, all our planning for our Logimat tour was questioned. Should we? So I went out and I bought lots of masks, sanitizers. We changed our planning that there was no sharing of rooms, and we started to think of contingency plans. I had to reroute all my flights because my original flight was through Milan to Geneva. Okay, and then a week later, we canceled the Logimat tour. The day afterwards, they canceled the Logimat exhibition. And on that day, South Africa had its first known positive case in South Africa. Okay, the World Health Organization then declared a pandemic on the 11th. And we then had that wonderful speech by our president on the 15th. And we had the second address and we were informed that we're going into a South African lockdown on the 26th of March, which we all remember. Okay, and our lives changed immensely. Okay, we had curfews, we couldn't travel anywhere, we sat at home, and all we could do was have grocery and pharmaceutical retail and a limited e-commerce. And suddenly the government said no apparel, no electronics, no furniture, alcohol, tobacco, restaurant, bars, car sales, hardware, schools. I don't think they thought everything through from a practical point of view. You could leave to go for essential services and goods. You could access health services, collect social grants, and go to funerals with 50 people. But I think the biggest thing was there was a lack of education. The army and police were deployed because obviously it's hard to maintain social distancing in townships and in workplaces that are congested. And when you're queuing for social grants for 2 days. And at the same time, they created peaks. So they limited hours that you could operate, which actually creates more congestion. And those things impacted on supply chains. So where were we and what happened? We had a lot of uncertainty. We had a lot of rule confusion. We had panic buying and queuing. We had business closures, job losses, havoc at the harbors, and people couldn't return home. They were stuck in other countries. And as a country, we took it seriously. And we said, okay, we're going to, hopefully the government will get our health infrastructure in place, and it will be over in 21 days, and then it extended to 35 days, and then it extended indefinitely, and we didn't understand. I think there were a lot of mistakes made. I don't think they understood the supply chain implications, and things could have been better. Let's not get into this reason for the cigarettes and liquor bans. I think otherwise we'll be here all afternoon. and everyone will be arguing and giving their viewpoints. But the rules were not logical or implementable. There was a lack of understanding of the implications of and effects of what they were doing. How do you know what's an essential item when you've got a ship coming into port with, say, 10,000 containers on it? How do you sort out what is essential? Then you get a different thing a couple of months later, weeks later, that we're only allowed to take blankets and children's clothing. How do you sort that out? I mean, some of the clothing retailers we work with had 12,000 containers in storage at some point in time. Okay. There are supply chains that are coming in that are planned 6 months in advance. And obviously some of those supply chains were impacted by what was happening in China, because there was also a shutdown on their side. And then suddenly these things arrived late and about to miss the season, and then we compound it and stop it at the port here. So what do we know? And the problems weren't only local. So I think a good understanding of what is supply chain could have helped a lot of people. And unfortunately, supply chain in government means procurement, and to a lot of people, it means an opportunity for a little bit of corruption and self-enrichment. And we need to change that perception big time, because without that, we're not going to be successful going forward. So solutions are required to ensure fundamental human needs were met. We had to understand the healthcare, the food availability and security, and the supply chain operations to facilitate that. Because without supply chain, you couldn't maintain food availability, security, and healthcare availability. We had changes in our operations, our business requirements, our forecasting and demand planning all went out through the window. I mean, you think about it from a perspective of what was planned, what was coming in, and what you could sell. You couldn't, it was chaos. And suddenly new products were items. I mean, people were stocking up on sanitizers and toilet paper. I have to give you a joke. Do you know why everyone was buying so much toilet paper? Anyone out there? No one? Okay, quietness. Okay, well, basically, a person would sneeze and 10,000 people would shit themselves. Okay, that's the best reason I can give for actually buying so much toilet paper. Okay, there were transportation challenges. We had trucks trying to get over the borders, and you'd get to a border point and you'd have to go into quarantine for 15 days. So you'd have to arrange a driver on the other side to pick up the truck. So a totally new game that you were dealing with. You had to try and mitigate spread. Suddenly you had to have physical distancing in all your operations. The way you shop, the way you run a warehouse, the way you hand over stock. From there, you had to give all your employees PPE. And so there was new legislation, new procedures, and then this massive surge in e-commerce. So it created a major change in what we do as a country, as a business, as what people's happening around us. Our forecasting and demand planning, the supply and reliable imports. Will countries be able to receive their seasonal labor? What's the state of our ports? I mean, our ports aren't great to start with, okay? And what was the implication? And we needed to map the whole supply chain and change the way to try and keep balance between demand, capacity, and inventory. And that was very critical. And I think going forward, we're going to see a reversal into local supply and nearshoring solutions, because people found that what was happening internationally on a global basis had a major effect. So I think people from a supply chain strategic point of view will look at lead times, your safety stock, what happens in the clothing industry in terms of markdowns, in terms of having the wrong product in the wrong time in the wrong season impacted by this, which could have been avoided. So that's going to be interesting. But we moved to level 1 on Monday. So is it over? Well, it's not over. For the pandemic to disappear, we need a vaccine or a medical cure. And it's very dangerous to actually become complacent at this stage to think that we're going to level 1 and it's all getting back to normal. And if I look out there on the roads, I traveled to my holiday house on the weekend, had to go fix something. And if I drove back on Sunday, or when I drove back, the traffic and the people on the road, it's back to normal. People are totally back to normal. The only difference is occasionally you see a person walking with a mask or driving with a mask. And obviously if in your car alone, driving with a mask is like lying in bed at night alone, hoping you're going to get lucky and put a condom on. So it's a bit stupid. I mean, but I've heard stories of where the cops are arresting people for driving in their cars alone without a mask. So don't ask me about what goes on in this country. But to be practical, we need social distancing. We need masks, we need limited group capacity, because we're going to have to stop the spread. Okay. Let's assume we get a vaccine or medical cure. Will that be the end? Well, without supply chain that can deliver the vaccine and the cure and associated items, all the vials, the syringes, the needles, the swabs, we will not solve the pandemic. And that's the key to what I wanted to chat about today. So how will supply chain impact the pandemic? We need to think about delivery of a vaccine to 60 million South Africans. Okay? You need to pause on that. I think the number of people that are living in South Africa at the moment that are HIV positive is something around about 15 million. And only about 9 million of them, we have been successful on getting them onto ARVs. Okay, so we're looking at a significant amount of vaccines that have got to go out. The other thing that's going to be interesting is, what will the vaccine be? Will it be a 1-shot, a 2-shot, or a 3-shot vaccine to try get the vaccine to be effective? Will it be effective only for a limited period of time? No one knows whether they can develop a lifelong vaccine, or is it a 1-month, 3-month, 3-year vaccine? And you'll have to have another repeat later. It's scary stuff out there. No one's got the answer to those questions. Okay, so how are we going to reach everyone? We need to think about the availability of all the things. I know that certain countries are stocking up on syringes, needles, and all the basics. So when the vaccine is available, it becomes a very quick rollout. My gut feel is we are doing nothing other than setting up some sort of people to actually be in this pipeline with illegal tenders that will get them vaccines where it should be 10 Rand at 150 Rand and make a lot of money. But I don't think people are thinking through the process. We need to think about the planning. We think about where we're sourcing. We need to think about the procurement and how we're going to deliver it. You cannot deliver it to everyone at the same time. So it's going to be over a period of time. And then we need to think about a medical cure, because people will still be getting sick until they become immune due to the vaccine. And we're not going to get everyone the vaccine instantly. We're still going to need PPE. We're still going to need to get the people to the distribution points, whether it's clinics or hospitals. So we need to plan social distancing and minimizing peaks. And all of those are supply chain planning issues. All of those are things that we need to think about in terms of supply chain, in terms of moving people, moving product. It's a supply chain solution. Okay. My guess is it will probably take 2 to 3 years to reach the full population of this country. To actually be able to, if we get a vaccine, get to a point that we can manufacture and source enough vaccines for the whole population, it's going to take us 2 to 3 years to distribute. So don't expect the pandemic to be gone tomorrow. Okay, I don't want to blow on everyone's parade, because we are excited about getting to level 1. Okay, so without a focus on supply chain, and that's what our job is to do, COVID-19 will be here to stay. We need to change the focus. We need to educate them. We need to get them to understand that without us as a community, they cannot move forward and have supply chain, have COVID gone, and supply chain will enable the solution. So that makes us the next heroes. Okay, so that was my thing. I just wanted to say who Relog is. We're consulting and infrastructure design specialists. We look at supply chain networks, logistics. I have to get my advertising in. Look at strategy, operations, infrastructure, and implementation. And here's my contact address if anyone needs to get hold of me. Okay, so back to the main point, and that's where I'll end. Any questions, comments, open up. I'm happy to try and discuss anything. Tanya, unmute everyone.
Okay, let me see if I can unmute everybody. Not sure how I do that actually. Other than unmute myself. Okay.
If anyone wants to speak, they can unmute themselves.
Yeah, no, they can. Anton, are you volunteering to speak there?
Sorry, I had a double-up meeting here, so I joined late. I'll catch up with Gary afterwards.
It looks like I've got most of the people here on my own crew because I said they should attend.
No, there are other people from outside as well.
No, they are, I see that.
So no questions. But we are definitely all in agreement that we are the heroes. Supply chain professionals are the heroes. There's no doubt in my mind.
And now, how do we get the message out there and tell everyone about that?
Yeah, therein lies the challenge. Therein lies the challenge, because the people that are making the decisions don't understand supply chain.
No, they think supply chain, when they hear supply chain, they think procurement and an opportunity to get a kickback.
Exactly, exactly. So lots of work to be done in that department, but hopefully with the work we're doing with the professionalization.
Maybe we need to change the name of what we don't call it supply chain. Maybe we've got to come up with a new terminology so that we're not tarred with that brush.
It's not a bad idea, actually.
Well, it should really be called supply networks, not supply chain.
Yeah, I don't know. It should be just getting it out there.
Getting your stuff.
Question. I had the impression that the most harm came from government decisions. Am I right? I would say mostly yes, but I'm pretty sure that the private sector are or have not contributed to this problem, should I say. I'm sure there are some guilty parties there too.
I think going forward, we learnt a lot through this process. Let's not belittle the government totally. They did what they could. South African government wasn't any different to other governments around the world. This thing hit you from the side, slapped through the face, and no one's had experience since the Spanish flu, and I think most of the people who lived through the Spanish flu aren't allowed today to tell us how that was solved. But I think it's been, in some ways, a lot of things have been lucky. We've had the technology. I mean, had this happened 10 years ago, we wouldn't have had all this Zoom and Teams and all of these abilities to communicate. This has facilitated things in a different way. It's moved us into a different space in the way we work and the way we've adapted. And unfortunately, it's actually accelerated a lot of things, and which happens. Wars have done it, and the pandemic has done it. I don't know if we'll ever go back to an old normal of going to face-to-face meetings as much as we used to. So we now will do Zoom and Teams meetings for the rest of our lives. And the next level will be that we'll be putting on those VR glasses and talking to people almost as face-to-face using virtual reality. And that technology is being developed. So in another 3 years with the next pandemic, okay, we'll be doing that and be sitting in the same room together, but virtually, not just looking at little boxes on a screen to look at your faces. But this has accelerated this immensely. The amount of e-commerce take-up that's happened. It was on a certain growth, it step changed into a whole different place. And a lot of technology has been developed. So we're starting to see, for instance, rapid testing for COVID-19 with instant results. I've just been given a box of 25 prototype tests, which I have on my desk here, that these things give result in 10 minutes. Sorry, there's the camera, but it doesn't, the virtual reality, virtual background doesn't like the box. Okay, but these things give a result in 10 minutes. And you're seeing that the latest spec on all the countries around the world, they're dropping the quarantine. If you arrive in a country now, you need a certificate of a test 72 hours before you fly. Within 72 hours of arrival, if you've had a test that shows you're negative, you'll be let into that country without quarantine. So maybe that would have been the solution right at the beginning, is to close international borders almost immediately, develop a test, and then put people onto a testing regime. And that would have stopped the spread, because no one could have come in unless they had come in negative. And countries could have been protected from it. And then only China, and they could have controlled it to actually get it down. The problem is we've allowed it to spread, and there are, I don't know how many million people in the world that have had the virus, and how many are active with the virus that are spreading it. And the secret is to stop them. And the big challenge for us right now is to avoid the second wave, which we're seeing in countries all over the world. And if we can avoid that, we'll carry on the curve we're on. I like the idea of, I was watching on BBC this morning, Milan Airport have implemented that they will have COVID-free flights. You cannot board the flight unless you've got a certificate. Now that makes me quite comfortable to get back on a plane. I wouldn't want to get on a plane right now and sit even to go to Joburg for 2 hours in an aluminium tube, not knowing who's sitting in the other side of the plane with me and what's their status. But if I know that everyone's had a test before boarding, I'd feel a lot more comfortable. And that will allow us to get to a sort of new normal. Okay, and that will limit spread. I think we're able to, we've learned a lot through this process of how to wear masks, how to sanitize. I think what's really been wonderful is I haven't had a cold this winter. And how many of you out there have had colds or flu this winter, which you'd normally have? Okay, so you think about it, those are positives. But it's going to be an interesting journey going forward. And so the government's done their best, but at the same time, they should have known that there's going to be the graft and corruption that came out of all those PPE and special things. I mean, it's almost as though they knew that was going to happen and they set it up to actually create another avenue of wealth creation. I don't know if I'm allowed to say these things publicly.
I wanted to comment also on this question of the government. Gary, sorry, I'm chipping in, you are still going on. But yeah, I wanted to say it's very difficult to talk about the government in South Africa or anywhere in Africa from Zimbabwe without sounding political. We can't even have good conversation and, you know, back and forth. Yeah, and maybe about the colds and flu, if I remember well, Clicks recorded that the lowest sales in the winter season, this winter flu season. And I work for J&J, we manufacture Benlun for flu. Of course, at first it was people buy a lot to keep at home, and then after they had it at home and everyone was washing their hands, social distancing, there was less spread even of the other flus, of the other normal flus. So I think, okay, this was about to happen, and it has increased the way we take care of ourselves, the hygiene measures that we do on a normal day-to-day basis at home, at workplaces, yeah. And maybe I can say I also agree when you say China kind of knew about this virus a long time. I think they knew what it was gonna do, but I think because of business interests or what, if they identified this area, World Health Organization as well, they should have locked down Wuhan. At first, the minute someone identified this virus can do this, if they locked down China, Wuhan, I don't think would have get this far. And last night, okay.
No, carry on.
I attended the ASEM conference, and there's this guy, Sean, I think Jenny's here, she's a big fan of Sean Kelly or Kelly, and he was talking about transformation, Internet of Things, moving from the 50th wave to the 60th wave. So if you link it up with technology, somehow this was bound to happen, and of course the virus has fastened up everything to where we are. And yeah, the new normal, I think, is where we are. The social distancing, like you're saying, being hygienic, and yeah, I think that's going forward. And for me, I think the government in South Africa, I think President Ramaphosa did quite well. That's my personal opinion. I don't vote in South Africa. I don't even vote in Zimbabwe anyway. So I think he did quite well. For me, all these measures were necessary. As much as some people were not abiding to the social distancing and everything was still going on as normal, it could have been much hectic. Yeah.
With respect, you're quite correct. We did a good job in a lot of spaces. We did stupid things, like trying to close a port and say you could only have essential items. How do you choose that? They didn't understand the ramifications. Did we need a liquor and cigarette ban? I don't know. We certainly did better than America. We've done better than Brazil. We've done better than India. We've done better than a lot of countries, but we haven't done as well as other countries. Yeah. So Ukraine, New Zealand, there's a list of countries that have done better than us. Then Germany, but then England's probably a problem. So politics have got in the mess, and that's an effect all over the world. But with respect to them, everyone's been learning and trying to figure this out. And we're going to get better at it, and we're going to hopefully solve it, and we will change our lives and become a new normal. You mentioned China. Let me tell you something about China. China went through MERS, SARS, and other diseases. For the last 15 years, when you get on a plane and Chinese people get on a plane, or you walk in a street in London, New York, wherever it go, Chinese people generally walk around still with masks. And you used to laugh at them, you know, but they learned from that process. And I think psychologically, China felt that they had a culture. And let's be honest, China's 1.6 billion people. The amount of people that were infected by COVID-19 in China relative to the population is minuscule. Okay, they had the ramp up in the beginning in Wuhan. They shut down, they controlled it. The unfortunate thing, a couple of people escaped and got out and spread it. But at the end of the day, China themselves actually came out very well. And that's because of the culture of, and one of the fundamentals where the failure happened was in America, the World Health Organization saying don't wear masks in the beginning. Okay? We didn't have masks until level 4, guys.
Yeah, that was late.
Okay, we had masks. I know that I went, when I was planning my Logimac tour, I said, bugger that. Why does a doctor wear a mask in a hospital, or my dentist wear a mask? It's an airborne disease. I'm going to go buy masks. I went and bought 150 masks in early February and they were freely available and they were dirt cheap. And from the beginning of level 5, whenever I went shopping, I wore a mask. And it's now logical that you should protect yourself and wear a mask and cover it. One of the other things people haven't thought about is you've got 3 orifices on your face through which the virus can come through, your eyes. And most people don't think about the eyes. So if you're in an open environment and there's airborne virus, someone sneezed or whatever it is, and you may have a mask on, it can still get you through your eyes. We bought all our staff safety goggles. So when I go shopping, I wear safety goggles. If I'm going into a supermarket that I feel I'm exposing myself and there's too many people and there's lack of social distance, I look like a dork and I wear these safety goggles when I walk into the supermarket. But so far, knock on wood, I haven't been positive. And Ken's okay, he wears goggles. That probably gives him at least 50–60% glasses on his face. And so, but a lot of people, I think, you know, could be getting it through their eyes. But we've certainly changed the way we will adapt, and it will take us years to go back to a normal.
Yeah.
Learn to live with your mask. Learn to live with sanitizing. But there's positives. You don't get flu.
Masks or something else. Okay, I have a question here for you. What do you think about President Trump's view of supply chain activities compared to those of President Ramaphosa's?
President Trump, interestingly enough, is actually pro-supply chain, and they're actually being driven to actually procure items to be able to distribute the vaccine. So in America, they actually are planning an ability to get vaccines out. They are stockpiling needles, stockpiling syringes and all of those items so they can accelerate the rollout. Obviously, he has a motivation to try and get it out before the elections, or to show that he's done a good job, because he's really screwed things up in the other ways. And if you listen to Fox, you'll support him. If you listen to CNN, you'll be against him. I think in South Africa, we've been treated like idiots. And so the government's taken a position of trying to control things. And in the same way, the people that are out there taking control, forgetting about Ramaphosa, but the rest of the people out there, they've tried to rule by force and put the fear of life into us, of that if you get caught there, you're going to get a prison record. If you get curfews, you can only exercise between certain hours. So our police minister and our health minister hasn't been too bad, but our wonderful minister, who was related to our ex-president, who will remain nameless, with her cigarettes and liquor bans, are not the greatest things, okay? And there's been some really lack of foresight and understanding. And I think what also been a failure is to engage with business community, to engage with the population on a more open basis. We're all in it. You know, I mean, the government is meant to be a representative of us, for the people, by the people, and that's not the case. It became a bit of a dictatorship during this period, which is, I think, wrong. But that's my opinion. So shoot me down.
We won't do that. Definitely not. Okay, does anybody else have any questions or comments, contributions to make to the discussion? I really don't enjoy when everybody's so quiet. I may have to pick on some people.
It's very strange for Jenny to be quiet.
Yeah, no, she's just sending
I'm
messages.
typing. I don't want to get involved in the political discussion. I'm checking. But what I did say in the chat was that I do think that one of the things that our government needs to recognize is that supply chain management. There's more to it than just buying the goods. And I think that's one of the fundamental failings, and unfortunately for other supply chain professionals, when anyone's talking about corruption or failure, it's always supply chain management that gets the blame, whereas a lot of the problem was actually in the procurement processes. But you know, it would have been great to see on the COVID task team some supply chain people. And I think that, you know, that's what they're going to have to make sure they do have when it comes to planning the rollout of the vaccine.
I think the biggest problem is still government's appreciation that supply chain is procurement.
And believe you me, we are trying to change that perception. The National Treasury has set up an interim council for supply chain management that's been funded by the GIZ. And every single session we have, every meeting, it goes back to the same thing. And every time I'm there, we have the same argument about procurement versus supply chain management. It's going to take a long time for them to grasp the concept. Even when they reference, there was a document that came out around the procurement bill, and they referenced it as supply chain management and not procurement. And that's why we have the problem that we have. It's because we've got such confusion about what supply chain management really is, that they just don't get it. So we need to find a way to make sure that we can try to
That's why I say maybe we must come up with a new name or acronym. I love 3-letter acronyms.
Okay, well, there's a job for everybody in the session. There you go. Think of an acronym for supply chain management that we can get everybody to understand. And Jenny's talking about our SIPS and SAPEX collaborative session next week, Wednesday. We're going to talk about exactly that. Where SIPS sits, where SAPEX sits, and how we complement one another in the end-to-end supply chain. That SIPS is not exclusively supply chain and SAPEX are not exclusively supply chain. That we all work together to complement one another. We all understand this. I mean, I'm preaching to the converted. But we need to do a bit of a shake-up with government, and it's going to be a long, hard road. That much I can tell you. But every little bit helps, and you know, if we can keep on having these discussions, then you know, hopefully at some point we will get through to them. I don't know what else to say, but it's not easy. So, no other questions or comments?
Tonya, that session you just spoke about. Well, I'm just going to say that session you just spoke about next week. I don't have that on my diary. I haven't seen that advertised.
Haven't you? Okay,
No.
we'll send you the details. But it's, as far as I know, it's definitely gone out. So you should have it. I think it's from 12
I usually reply to these things pretty quickly.
No, I know.
From when? 12 to 1?
Yeah.
Next Wednesday.
Yeah.
Oh, okay.
Help. So hopefully we'll get lots of public sector people join the session so that we can unpack the supply chain issue with them. But we also want to make it so that people can be portable between public and private sector. So a supply chain professional is a supply chain professional, because the principles. Imagine if we had effective supply chain principles in the municipalities. What a difference it would make to our lives. Think of that. You know, it's these type of things that we need to be pushing for. And it's our responsibility to do it. So, you know, collectively we need to work towards that.
Yeah. Actually, I was going to ask you, Tonya, like at the present moment, we know the vaccine is coming. I only know SAPEX. I don't know much of other organizations that are here. I wanted to ask, how are you positioning yourself to bring value as an organization in supply chain in South Africa. I don't know how they procure, the government, what they do, but any actions for you to position yourself and bring value.
It's a difficult question to answer, if I have to be honest. So we understand the value proposition and why we're here and what we do, and that is to share best practices, introduce new methodologies, to elevate skills and knowledge in people in the profession so that they can improve business efficiencies and ultimately, big picture, the economy. The problem comes in where the people in public sector, government, don't understand supply chain management. So they have no appreciation for who we are, what we do, and what our value proposition is. And like I said, we have these discussions with this council that's driven by National Treasury, yet the penny just doesn't seem to drop. It's gonna take us a long time to try and change this thing around, and it's a lot of hard work. So yeah, I don't know. And as long as the government officials are talking about supply chain management as if it's procurement, the longer we're gonna go on with this challenge. I don't know, Gary, do you want to jump in here and make a comment?
Maybe I can add before Gary reply, because for me, Tonya, the thing is, this is an organization on supply chain. You are here, you are on the ground. It doesn't make sense for me to have NGOs, coming in, chipping in, and there's other organizations that are not even here, being contracted or being consulted on, but yet we are here, like there's this organization,
I hear you.
I think it's going to come down to our professional body. It's going to come down to education. And I think the unfortunate thing is supply chain isn't professionally recognized. Once it's professionally recognized in the right way, that will actually help with the right understanding. Because at the moment, it's a loose terminology, supply chain, and is it procurement? Is it corruption? Is it?
Oh, Gary.
Maybe we're wrong, guys. Maybe we should jump on the other bandwagon and we'd all be rich and we won't be sitting here. Maybe we've got supply chain wrong. Come on, guys.
No, we're on the right side. We're on the right side. So no, I do think that you're right about the professionalization. Gamo, are you aware of the professionalization and the designations and things that we're busy doing?
No, funny enough, Tonya, I'm a pharmacist by basic qualification, and you know how I found supply chain interesting, like very much. So it's at a point where someone does some other programs and then they supply chain, then they complement, they do another course. I've got another friend of mine, she did pharmacy. She was a DHL, then she did a bachelor's degree in supply chain and operation management. And forget, I just checked I think it's Relog, there's a number of the colleagues there who are from industrial engineering. So I don't know how you're gonna do that to professionalize. Do you want to professionalize it, or just, I don't know, because the way it is for me now, it's okay. A lot of people actually want to acquire that knowledge of, yeah, I don't know.
It's a much bigger picture. So if you are available on Wednesday to join that webinar between 12 and 1, it would be good for you, because it'll give you more insights in terms of what we're doing with professionalization, why we're doing it, what are the different elements to it, and how we believe that it's going to add value ultimately to the country and our economy. So that's kind of the big picture. But that's I mean, I can get into this and talk about it for hours, and everybody's going to sit here and roll their eyes and say, listen, this is not what we signed up for. So if nobody else has any other comments or questions for Gary, we shall release him.
Can I just add one more thing quickly, is that there's also that professionalization debate or discussion that you're doing with the ASCA team on some people from around Africa on the 30th, and that is not on the calendar yet, but that's on the 30th, and we'll send that round. I'll pop the link in the chat for the SIPS meeting next week. It's just an hour at lunchtime.
Perfect. Thank you, Jenny.
Okay.
Jenny, will you send me the link to this evening's meeting?
I don't know. I can't. I'll get it sent to you.
Okay. I'll
I'll
send
get
a
it.
I did ask Dave, but his messages are not going through. So I'll give him a call.
Okay.
Okay, guys. Gary, thank you so much for your time. Thank you for that interesting conversation, and some interesting comments, and some humor along with it as well. I really like the toilet paper joke. That explains a lot. Thank you guys for all being here and joining us this afternoon. And as always, for your support of SAPEX. We really do appreciate it. And we are going to cut back Community Connect to once a month, because now everybody's back at work and they're working very hard and they don't have time to connect with us as much as we'd like them to. So we'll make it less, and hopefully we'll have more people joining us again. But thank you guys for joining us, for being here. Have a super evening, and we will catch up with you soon. Thanks, Gary.
Yeah, thanks, Jenny. Thanks, everyone. Cheers.
Thanks, everyone. Cheers.
Okay,
Bye-bye.
thanks, Gary. Thanks,
Bye.
Jenny.